A middle-aged gentleman came to see me because he had abdominal pain and an unusual difficulty building up his ab muscle on the right side of his abdomen. Every time he would do a crunch, the right abdomen would hurt, and the muscle would cave inward rather than outward. He enjoyed hiking with his wife and playing tennis with his friends, but he could not do anything, including putting his shirt on, as his stomach would hurt. He initially dismissed it as a vague stomach issue, but soon found it increasingly difficult to let anyone or anything touch his stomach. When he came to see me, he was found to have a long-standing history of diabetes. After an evaluation, he was found to have a diagnosis that shook John to his core: diabetic thoracic amyotrophy. John had been managing his type 2 diabetes for years, but he had never heard of this rare complication. He felt overwhelmed with questions and anxieties. What did this mean for his future? Would he lose the ability to do the things he loved? This essay aims to shed light on diabetic thoracic amyotrophy, its symptoms, causes, and treatment options, providing hope and clarity for those facing this challenging condition. Diabetic thoracic amyotrophy, also known as diabetic amyotrophy or Bruns-Garland syndrome, is a rare neurological disorder that primarily affects people with diabetes, particularly those with type 2 diabetes. This condition falls under the umbrella of diabetic neuropathies, a group of nerve disorders caused by diabetes. While diabetes commonly affects the peripheral nerves in the feet and legs, diabetic thoracic amyotrophy specifically targets the nerves in the chest wall, upper back, and arms. This nerve damage leads to muscle weakness, pain, and atrophy, primarily in the shoulders, arms, and hands. In his case, it was his abdomen. The onset of diabetic thoracic amyotrophy is often gradual and can progress over weeks or months. Understanding the specific nerves affected and the potential impact on muscle function is crucial for early diagnosis and effective management of this condition. Diabetic thoracic amyotrophy typically announces itself with a constellation of symptoms that often develop asymmetrically, meaning one side of the body is affected more than the other. The most noticeable symptom is muscle weakness. This weakness can make it challenging to perform everyday tasks that require arm strength, such as lifting objects, reaching overhead, or even combing one's hair. Alongside muscle weakness, individuals may experience pain in the affected areas. The pain can range from a dull ache to a sharp, burning sensation. Some individuals also report numbness, tingling, or a pins and needles sensation in the arms and hands. These sensory disturbances can further complicate daily activities and contribute to feelings of discomfort and frustration. While the exact cause of diabetic thoracic amyotrophy remains elusive, researchers believe that poorly controlled blood sugar levels play a significant role in its development. High blood sugar can damage blood vessels, including those that supply nutrients and oxygen to nerves. Over time, this damage can disrupt nerve function, leading to the characteristic symptoms of diabetic thoracic amyotrophy. Other factors that may contribute to the development of this condition include the duration of diabetes. As people who have lived with diabetes for a longer time may be at higher risk. Age, since diabetic thoracic amyotrophy is more common in older adults. Obesity, because excess weight can worsen insulin resistance and contribute to nerve damage. And smoking, as smoking damages blood vessels and can exacerbate nerve problems. Understanding these risk factors is essential for both prevention and early intervention. Section 5, Diagnosis, a critical step. Diagnosing Diabetic thoracic amyotrophy can be challenging as its symptoms often mimic those of other conditions, such as carpal tunnel syndrome, cervical radiculopathy, that's a pinched nerve in the neck, or even more serious neurological diseases like amyotrophic lateral sclerosis, also known as ALS. A thorough medical history, physical examination, and a battery of tests are crucial to rule out other potential causes and confirm the diagnosis. The diagnostic process typically involves electromyography, or EMG, and nerve conduction studies. These tests measure the electrical activity of muscles and nerves, helping to identify nerve damage and its location. Blood tests are also essential. They can rule out other conditions and assess blood sugar control. And of course, imaging studies like MRI or CT scans may be used to visualize the affected nerves and rule out other structural abnormalities. Early diagnosis is paramount for initiating prompt treatment and improving long-term outcomes. Section 6. Treatment options. A multifaceted approach. While there is no cure for diabetic thoracic amyotrophy, a combination of treatments can effectively manage symptoms, improve quality of life, and potentially slow disease progression. The primary focus of treatment is to optimize blood sugar control through lifestyle modifications and medications. This may involve diet and exercise. Following a healthy diet and engaging in regular physical activity can help regulate blood sugar levels. Medications, oral medications, or insulin injections may be necessary to manage blood sugar effectively. In addition to blood sugar control, other treatment options may include pain management. Over-the-counter or prescription pain relievers can alleviate pain and discomfort. Physical therapy. Targeted exercises can help maintain muscle strength, improve range of motion, and prevent muscle contractures. Occupational therapy. This can assist with adapting to daily activities and using assistive devices if needed. Section 7. Coping with diabetic thoracic amyotrophy. Receiving a diagnosis of diabetic thoracic amyotrophy can be emotionally challenging. It is crucial for individuals to have a strong support system in place to help them cope with the physical and emotional aspects of the condition. Connecting with loved ones, support groups, or mental health professionals can provide invaluable emotional support and guidance. Practical tips for coping with diabetic thoracic amyotrophy include pacing yourself, avoid overexertion, and take frequent breaks to prevent fatigue. Modifying your environment, make necessary adjustments at home and work to accommodate physical limitations. Using assistive devices. Explore the use of tools and gadgets that can make daily tasks easier. Staying informed, educate yourself about the condition and its management to make informed decisions about your health. Section 8. The road to recovery. The prognosis for diabetic thoracic amyotrophy varies depending on the severity of nerve damage and the individual's overall health. However, with early diagnosis, proper management of blood sugar levels, and comprehensive treatment, many individuals experience significant improvement in their symptoms and can live full and active lives. Recovery from diabetic thoracic amyotrophy is a gradual process that requires patience, persistence, and a positive outlook. While some residual weakness or pain may persist, most individuals regain a significant degree of function and independence over time. Section 9. A beacon of hope. Diabetic thoracic amyotrophy can be a daunting diagnosis, but it is essential to remember that it is a manageable condition. By taking an active role in managing your diabetes, seeking prompt medical attention if you experience any symptoms, and embracing a holistic approach to treatment and self-care, you can navigate the challenges of this condition and live a fulfilling life. The journey may have its ups and downs, but with the right knowledge, support, and determination, there's always hope for a brighter tomorrow.